have checked the doctor's order and I have read the hospital policy. I have gathered all the equipment needed for this assessment. So I have gathered stethoscope, I have pen light, I have a tongue depressor, I have a draw sheet for privacy purposes, and I have some gloves. Okay, so let's begin. Knock, knock. Come on in. Okay, foaming in. Using sanitizer, putting on any PPE needed. So I'm gonna wear the gloves, closing the door for privacy, and introducing myself. Hello, my name is Kamal and I am an ACC nursing student. How are you doing today? Good, good. Can you tell me your full name and a date of birth, please? Eva Jones, 1/1/1990. Okay, thank you so much for that information. Let me go ahead and compare the medical record number by looking at your wristband. And it matches to my doctor's order. Perfect. Do you have any allergy, Mrs. Jones? Don't have any allergies, okay. So I'm here today to perform a physical assessment on you. So we'll be moving a lot around today, and yeah, so do you have any question for me before I begin? No question, okay. So I just want to ask some silly question like, do you know where you are right now? You're at the hospital, okay. And do you know who is the president right now? Joe Biden. Okay, thank you so much. Okay, so that was alert and oriented times 3. The patient is alert and oriented to self, to person, place, and time. And so when I walked in, when I entered, I have also checked for airway, breathing, circulation, and I have ruled out any emergency situation. Everything is intact. All the equipments are attached as it's supposed to, and the patient doesn't show any sign. Patient has no sign of distress, and his behavior is pleasant and responsive, and has appropriate effect. Patient appears to be in good hygiene, proper nutrition, and good health. Okay, so Mrs. Jones will be, I'm going to raise the bed to working height. I'm going to lower the side rail. Mrs. Jones, I'll be taking your vital sign now, okay? Do you have any question? Okay, no, okay. So I have taken Mrs. Jones' vital sign. The blood pressure was 118 over 75 millimeter of mercury, and the temperature was 98.7 degree Fahrenheit, and then the respiratory rate was 18 breaths per minute, and the pulse was 80 beats per minute, and the oxygen saturation was 98%. Perfect. Okay. And are you in any pain, Mrs. Jones? No pain. Okay. Alrighty. So I will start from head to toe. Do you have any question? Are you feeling okay right now? Okay, no pain. The patient responds well and understand the commands. So I'm going to start with palpating the head. Okay, I'm looking for any lumps, bumps, bruises, and patient doesn't have any lumps, bumps, bruises, any sores. Don't see any of that. Okay, so it all is good. Okay, no lumps, no bumps, no bruises. That's good. The head shape is normal in shape and size, and the face looks symmetrical. There's no drooping in one side of the eye or the another. So Mrs. Joan, I will go ahead and look into your eyes now. Do you wear any kind of glasses or contact? No, you don't. Do you have any problem with your eyes? No? Okay. So I'm going to dim the light, and I'm going to have the pen light and come under and checking for the pupil. Okay, perfect. Okay. And I want you to look at the wall and look at the light. Look at the wall, look at the light. So that is accommodation. So that was Perla test. The pupils are equal, round, reactive to light and accommodation, and there's no extraocular movement. So I'm going to turn the light back on. No extraocular movement, and the sclera looks wide. There's no like drainage or anything coming out. So looks good. So Mrs. Joan, now I will go ahead and inspect your ear and look into palpate your ear, okay? Okay, I don't see any lumps, bumps, bruises, any lesion, any polyps, so any of that. And Mrs. Jones, so I'm going to look inside your ear canal to see if there's any bleeding, any polyps, redness, tenderness. I don't see any of that. Can you turn to your right? Okay. I'm looking into your ear canal. I don't see any of that, and there's no redness, tenderness in your external ear canal. And do you wear any kind of hearing aid? You don't wear any kind of hearing aid. Okay. Alrighty. So have you had any problem with your hearing recently? No problem. Do you hear better with one ear or the other? Equally. Okay. Alright. Thank you. Okay. So I'm going to take the temporal pulse bilaterally. So it's equal. Perfect. Okay. So now I'm going to assess the temporomandibular joint, symmetrical and absence of any abnormalities. So now, Mrs. Joan, I will look into your nose, okay? Can you go ahead and turn your right, close your right nostril and sniff, okay? And the other one, sniff. Any problem? No. Do you have any problem with the smelling issue? No, okay. So Mrs. Joan, I'm going to listen to your nose inside to see any kind of deviated septum or any polyps or of any kind. I don't see any redness or polyps or drainage of any kind, so it all looks good. So now I will go ahead and can you smile for me? Look into your mouth, smile, and it's symmetrical, and the lips is not dried, so the lips is perfect. It's not. I'm looking here for dryness or any kind of discoloration. It looks pink and perfect. Okay, can you go ahead and open your mouth for me, please? Okay, here I'm looking at the teeth, and I don't see any breaking or missing teeth, caries, any of that. So it's absent of that. The gums are not bleeding, and looks good. Can you do all for me? Okay, here I'm putting the tongue depressor between like 2/3, and I'm just assessing. It doesn't, so I don't promote the gag reflex. Uvula lifts up as it should be. It appropriately lifts up, and I don't see any inflammation, swelling of any kind. There is no white patches. The tongue, the mucous membrane is pink and moist. The tongue is not inflamed, and the hard palate, soft palate, all looks good. Okay, do you wear any kind of dentures or bridges, Mrs. Jones? No dentures, no. And of course I will trash the tongue depressor. And okay, so I will go ahead and check at I'm going to do the carotid pulse once at a time, so I don't cut out the circulation, once at a time. Perfect. Okay, and push, pull up. Good strength. And can you turn to your left? Good. And I'm looking for JVD, which is jugular vein distension, and it is absent of that. I don't see any jugular. Okay, turn to and the patient follows command, and response is appropriate. Okay, no jugular vein distension. Okay, good. I'm going to check the skin turgor here about the clavicle. The turgor is normal, rebound appropriate. So now I'm going to check for any kind of like tenderness, any swelling, any swelling of the joint, and checking on the bony prominence, looking at the color, temperature. Towel looks warm, the temperature is warm, and yeah, it's perfect. Okay. And I'm going to check the brachial pulse here at this point, bilaterally. It's equal bilaterally. So now I'm going to check the cap refill, which is less than 3 seconds. Perfect. Same with this finger. Less than 3 seconds. Perfect. Can you go ahead and squeeze my hand? Oh, good strength. Now pull, push. Good strength in upper extremity, and no swelling, no tenderness of any kind. Okay, so okay, all right. So Mrs. Joan, I'm going to, and I don't see any IV site. There is no IV site or dressing site, and it's asymptomatic, which means like there's no phlebitis, no infiltration, like inflammation of vein or something like that. And yeah, come down and look at the. Okay, Mrs. Joan, I'm going to check the temporal pulse. So I have the, for privacy, I'm going to expose you only what I need. So I'm going to check for the femoral pulse here, bilaterally. It's equal and strong bilaterally, perfect. Okay, oh, I forgot to do the radial pulse. I'm going to do radial pulse bilaterally. Perfect, okay. And once I do the femoral pulse, I'm going to check for the calf tenderness. I'm going to check for any bony prominences, any swelling of joints. Don't see any of that. Okay, while I'm here, I'm going to do the popliteal pulse. Okay, equal bilaterally. And I'm going to take off the socks. And I'm going to do the posterior tibialis. And I'm going to dorsalis pedis bilaterally, perfect. And I'm going to check the heels. And I don't see any breakdown, rashes, redness, I don't see that. I'm going to check the capillary refill, less than 3 seconds, perfect. And I'm going to check between the fingers, toes, fingers, to see if there's any skin breakdown. Don't see any of that. Each fingers, I don't see any of that. Can you pull? Oh, good. Can you push? Good. Good strength in lower extremity, and no swelling, no peripheral edema. Looks good. Okay, so once I have touched the finger, I'm going to take off my gloves. And I'm going to wash my hand, and I'm going to sanitize. Okay, so after that, I'm going to wear my gloves. How are you doing, Mrs. Jones? Doing good? Okay, so now, I'll be listening to your heart, your lung, and your belly. Do you have any question for me? Don't have any question. Okay. Okay, so we'll start from second intercostal space, right to the sternum. Here we have the aortic, it's an S2 sound. And this is caused by closing of aortic and pulmonic valve at the end of systole. Second intercostal space, left to the sternum, we have pulmonic. This is also where we'll hear S2 sound. Okay, and if you want, we can go one down and listen to third intercostal space, left to the sternum, we'll have the Erb's point. This is where we'll hear any pacemaker or heart murmur. Fourth intercostal space, left to the sternum, we have tricuspid valve. We'll hear S1 here. And fifth intercostal space, left to the sternum, and mid-clavicular, we have apical mitral valve, and here we'll hear S1 sound. And this is, at this point, we'll hear the radial apical for 30 seconds. If it is irregular, we'll do it for 1 full minute. Okay, alrighty, so now we're going to assess for the lung. Assess the lung. Do you have, I don't see any shortness of breath, and it looks good. Can you go ahead and take a deep breath from me, Mrs. Jones? Okay. This is where you hear the bronchial sound. Going down, We have bronchovesicular, vesicular sounds, vesicular sound. Okay, and at the right side we have 3 lobes, so have the patient, can you move your arm up, and then mid-axillary, well, I'm listening to right middle lobe, vesicular sounds. Okay, good. So this is Joan, can you sit straight up for me? Okay, patient listens to appropriate command. Okay, so it is the spine, scapula between this. Perfect. Vesicular sound. Vesicular sounds throughout. The bottom of the lungs. Perfect. While I'm here, I'm going to look for the skin breakdown, if there is any redness, rashes. I don't see any of that. It happens even at the coccyx and hips. No breakdown, and it looks good. No rashes, no redness, no tenderness, no pressure ulcers. It all looks good. Okay, you can sit back down, Mrs. Jones. Thank you so much. I'm going to lay you flat so I can assess your abdomen. Doing okay? Good. And I didn't hear any adventitious sound in the lungs, such as rhonchi, wheezes, and crackles. I hear all the normal sounds, such as vesicular, bronchovesicular, and bronchial sound throughout the lungs, and no abnormal sound, no adventitious sound. Okay, so now I'm going to inspect here for any mass, any distension, any scars, any wound, bumps, bruises of any kind. I don't see any of that. So I'll go ahead. Next step is auscultate. So I'll start from right lower quadrant. I'm going to hear 5 to 15 seconds. So where the ascending colon begins, the gut begins. So right upper quadrant, there is the transverse colon, left upper, left lower. Okay, I hear bowel sounds in all 4 quadrant. Bowel sounds in all 4 quadrant. Okay, so Mrs. Joan, I will be slightly palpating you. Let me know if you feel any pain. Okay, I want you to stop me. Okay, any pain? No pain while pushing. Any pain, Mrs. Joan? No pain while releasing. No pain. No pain. Okay. Alrighty, thank you, Mrs. Joan. I'm going to ask you a question. When was your last bowel movement? It was yesterday, and was it normal for you? Okay. When was the last time you urinated? Just a few, like hour back. Okay. And did you happen to see? What color did you urinate it? It was yellow. Okay. Any strong odor that you noticed? No strong odor. It was yellow. Okay. It was cloudy or clear? It was clear. Okay. Alrighty. And okay, did you get up and use the restroom? Did you walk? Okay. Do you use any kind of assistive device like a walker, cane? No, you did not. Okay. Alrighty. Do you have any problem like walking or imbalancing? No, you don't have any problem. Okay. And what about the breakfast this morning? Were you able to digest well? Okay, you were able to handle properly. Okay. And did you have any problem like nausea, vomiting, chewing, swallowing? Any problem with that? No, you're able to handle it pretty well. Okay, alrighty. Sounds good. And she said you digest pretty well food and stuff. Okay. And were you able to empty your bladder fully? You did. Okay. And any pain or discomfort while urinating or emptying bowel? No pain. Okay. Alrighty. So Mrs. Joan, I will now go ahead and so we will do the range of motion. So I will be at the end of the bed and I want you to mimic what I'm doing, okay? Okay. So beginning with shoulder. This is neck flexion, extension, flexion, extension. We have neck rotation. We have lateral flexion, shoulder to chin, lateral flexion. Okay, you doing okay, Mrs. John? Okay. So now next will be for the shoulder. We'll do flexion, extension, flexion, extension. Okay. So next we'll do circumduction, circumduction. Okay. I want you to stop me. Okay, if you're feeling any pain or discomfort. Okay. Next will be the internal rotation, external rotation, internal rotation, external rotation, internal rotation. Okay. Okay. So and then we do an abduction, adduction, abduction, adduction. Okay. For the elbow, we're going to do supination, pronation, supination, pronation, and we're going to do flexion, extension, flexion, extension. Okay. For the wrist, we're going to do flexion, flexion, extension, hyperextension, flexion, extension, hyperextension, and then we're going to do the radial and ulnar flexion, radial and final flexion. Okay, for the fingers, we're going to do opposition, opposition, okay, which fingers opposition, and we're going to do abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, and flexion and extension, flexion and extension. Perfect. Okay, so now we're going to do our hip. So we're going to do flexion, even the knee, and extension, flexion, extension. Now we're going to do circumduction, and circumduction. Okay. We're going to do abduction, adduction, abduction, adduction. We're going to roll internally, internal rotation, external rotation, internal rotation, external rotation. Okay, so we're going to do the ankle. We're going to do plantar flexion, facing down, dorsiflexion, plantar flexion, dorsiflexion, plantar flexion, dorsiflexion. Okay, and now we're going to rotate it inwardly. Like eversion, inversion, eversion, the inversion, eversion. Okay, this all. Okay, good. And for the toes, we're going to do the same thing, like as a finger, except for the opposition. So we're going to do flexion, extension, flexion, extension. We're going to do abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, abduction, adduction, and yeah, so that was a range of motion. Perfect, thank you. Are you doing okay, Mrs. Shaw? Okay, good. So now we will ambulate Mrs. Joan. So I want you to sit at the end of the bed for me. I'm going to lower the bed and I'm going to put the side roll up. Okay. Okay, dangle here for a couple of minutes. This time it would be like it will prevent from orthostatic hypotension. Perfect. Okay. Do you feel any nausea, vomiting? No. Okay. None of that. Alrighty. So I want you to. You think you can walk? Okay. Alrighty. So I want you to walk by the door. Okay. And I'm watching the patient go, and I'm looking at the gait and posture. So the gait is normal and the posture is aligned properly, appropriately, and has no spinal imbalances. It's perfect. Looks good. Okay. Okay. Come on, sit down. And the patient doesn't have any risk of fall. Okay, do you feel any kind of numbness or tingling or parentheses? No, no numbness, no tingling, no swelling of the joint. Okay, so all looks good. Okay, alrighty. And no edema, no. Okay, alrighty, perfect. So Mrs. Joan, so I am done with my physical assessment. I know that was a lot, so I'll let you rest. I'm going to put both the side rails up, put you in the lowest position, and do you need to go use restroom? Are you in any pain? Do you have all your possession nearby? And is it position comfortable? Okay, so here is the call light. I want you to call me if you need me for anything, okay? And alrighty. Okay, so I'm going to take this off. I'm going to foam out and close the door for privacy. Okay, that completes my assessment.